Alrighty, everyone. So today we're going to be talking about the leprosy disease and just kind of giving an overview of the disease, the treatments, the signs and symptoms, where it comes from, what exactly is it, and just a general overview. One of the reasons I did choose to study leprosy is because I am a microbiology major, and I know that there's not as much research done on it as a lot of scientists would like, mainly because microbacteriums are a little harder to treat in labs and it does compete with other microbacteriums like the ones that cause tuberculosis. And another reason why I kind of chose it is because leprosy has had this long-standing stigma towards it that it's infectious in nature and it causes the disfigurement and dismemberment of like certain body parts, so that basically it tells people and kind of created the stigma that the patients with leprosy should kind of isolate and there's no cure for it, and just a stigma that is completely incorrect as there are current treatments and it is non-fatal. So the first thing I am going to talk about is what is leprosy, right? So another common name for it would be Hansen's disease. It is, again, non-fatal and this intracellular pathogen. It is a chronic and it is an infectious disease. It is caused by the microbacterium leprae. And so this microbacterium, it's classified as being acid-fast, gram-positive, rod-shaped bacillus, and the entire bacterium does have one of the longest doubling times of all known bacteria, about 14 days, which is pretty long for bacteria and pretty long for microbacterium specifically. And it is the only microbacterium known to directly infect nervous tissues. So it's going to cause peripheral neuropathy. It's going to cause a lot of things that are going to directly attack like skin nerves and stuff like that. So if we look here to the right, this is a picture of Gerard Henrik Ammer Hansen. He was a Norwegian scientist who actually discovered the leprae bacilli in 1873. He was the first one to classify and kind of identify it and name it, and he saw that it caused leprosy, and with this, he kind of disproved the hereditary affliction theory, which basically said that these microbacterium were passed down from parents to offspring, which he disproved because leprosy is not genetic in that sense. So where exactly did leprosy originate from? There's not a lot of research done on this just because it is pretty relatively old disease, and it was classified in later years. So the exact date and place of origin is unknown. However, a lot of researchers and scientists kind of have found descriptions of leprosy-like diseases with leprosy-like signs and symptoms, dating back to 1550 BC with written documents such as Egyptian papyrus, or in 600 BC with Indian writings, and in 62 BC with Rome. There's a lot of records in ancient Greece that talk about leprosy or leprosy-like diseases, and a lot of the times this was after the army of Alexander the Great came back from India and after the return of Pompey's troops from Asia as well. So it has a lot to do with wars and being described in war tellings. As far as how leprosy is transmitted, so most of the time we know it is transmitted through a species of armadillo, which is native to southern United States and Mexico. Just touching any type of droplets that the armadillo might secrete would get a human to be exposed to the Mycobacterium leprae, but that does not necessarily equate to them contracting leprosy. It's just an exposure. However, if there is nasal secretions or droplets, it's more likely to be transmitted, and it is not airborne, which means it's not as highly transmissible as other microbacterium we know of, like tuberculosis. One of the crazy facts about it is that it can be contracted at any age, and again, it is not inherited. The inheritance pattern is currently unknown, but if you have been exposed to leprosy in the past, you do have an inherited increased risk of contracting the disease, and the susceptibility tends to run in families who have been exposed to the bacteria previously. As far as the signs and symptoms and where or what leprosy actually affects, so again, it's going to cause peripheral neuropathy. So what that is going to do is attack the skin, attack the peripheral nerves, attack the mucosal surfaces of the upper respiratory tract and the eyes, oftentimes leading to blindness. And one of the first signs and symptoms you can see is skin lesions. So leprosy is primarily characterized by these skin lesions you can see here. This picture is depicting a patient who is far along in the stages of these of leprosy. This isn't what it would look like on the first day of contracting it or even the first day of exposure. So we see a lot of muscle weakness or paralysis in patients, a lot of eye problems, again leading to that blindness if they do get complicated, a lot of nosebleeds, and a lot of numbness in the hands, feet, arms, and legs, which again comes back to the leprosy bacteria, microbacterium attacking the skin and attacking those nerves on the skin. I would like to mention that the signs and symptoms can take anywhere from several months to 20 years to appear. So it was very hard with previous treatments um, before the 1870s, right? So in the early 1800s, they didn't really know or have a name for what was going on and the disease that was happening as an effect of this microbacterium. So in the early 1800s, there was actually oil that doctors were extracting from this chalmugra nut. They were giving it to the patients orally, which was a terrible treatment method, and it was just painful. It would give them nausea and kind of disturb their entire digestive system because the oil was kind of grabbing the lining of the stomach. It also, at this time, this oil would treat psoriasis, rheumatism, and scabies because of its tremendous anti-inflammatory properties. Um, it does have a foul-smelling odor, and it is native to Myanmar and India. The tree that these seeds particularly come from is called Teratogenous curzi, which again, the doctors would administer that oil after the seed was extracted and filtered. Going into the late 1800s, we saw a lot more of intramuscular and intravenous injections, so less orally, but these two had side effects. They would cause abscesses and pulmonary embolism. And so the first time we actually did see intramuscular and intravenous injections was in Cairo, which is very interesting, as now Cairo is one of the places which has the multi-drug therapy, which does cure leprosy in current treatments today. And this is my presentation, just a little quick overview on leprosy. I do hope that you enjoyed this, and I will see you all in class very soon.